Hello and welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan, and today I will be talking about a journal article recently published in the Journal of Cardiac Critical Care, published by Scientific Scholar. Analysis of risk factors associated with early mortality in total anomalous pulmonary venous connection repairs performed over a period of 10 years, a retrospective observational study. Total anomalous pulmonary venous connection, that is TAPVC, is a congenital cardiac malformation. If it is not required surgically, the chances of survival of the patient are meager. Now, due to the improved perioperative care and surgical techniques available these days, the overall results have also improved. Now, this study that I am discussing assesses the risk factors in relation to early mortality in TAPVC repairs performed over a period of 10 years by a single surgeon in the institute. 88 patients who were surgically treated for TAPVC at institute over a period of 10 years by a single surgeon formed the basis of this retrospective observational study. The information regarding patient demographic details, pre-operative evaluation, surgical procedure, post-operative course, and even the follow-up after discharge were retrieved by searching the operation theatre registers, medical record sections, and finally by patient follow-up in outpatient department or even a telephonic follow-up. The results showed that out of the 88, 64 were male patients and 24 were female patients. About 25% of the participants had age of less than 1 month. About 25% of the participants had age of less than equal to 1 month. The TAPVC type was supracardiac in 46.6% cases, cardiac in 27.3%, infracardiac in 15.9% and mixed in 10.2%. Of the 88 TAPVC patients, 33 were obstructed at the time of operation, 29 patients had to be taken up for emergency, 13 patients were on mechanical ventilation pre-operatively, and 18 patients required pre-operative inotropic support. Mean cardiopulmonary bypass time in the study was 63.36 minutes and cross-clamp duration was 34.4 minutes. Patients required to be ventilated post-operatively for an average of 4.18 days. Mean intensive care unit and hospital stay were 8.01 days and 17.8 days respectively. 11 patients died post-operatively. Out of these, 8 had age of less than equal to 1 month. All of the 11 mortalities had at least some PAH in the post-operative period. However, 16 out of the surviving 77 patients had PAH. Therefore, it was concluded that supracardiac type was the most common subtype of TAPVC, followed by cardiac. Early mortality was 12.5%, while late mortality was 3.9%. Age less than equal to 1 month, low weight at the time of surgery, pre-operative obstructive pulmonary veins, pre-operative need of mechanical ventilation, pre-operative inotrope requirement, repair of TAPVC on an emergency basis, and post-operative PAH were important risk factors for early mortality. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.